Welcome to an overview of sports physicals. Here you will learn the importance of a sports physical, the appropriate history questions and physical exam findings, sport-specific considerations for individuals with certain conditions, and a better understanding of how sports can be both beneficial and harmful. Here is a case to whet your palate. A 17-year-old male basketball star who is supposed to be the family's ticket out of poverty is play fighting in the cafeteria with a girlfriend. After being hit in the chest, he has a resultant episode of VFib and subsequently defibrillated. He presents after a complete recovery and wants your approval to return to basketball. This is just one example of the many considerations you may encounter in a sports physical. Cardiovascular events are just one of many types of problems you may encounter in a sports physical. Below, you can see the distribution of cardiac-related causes of sudden death that may be prevented by an appropriate sports physical. Sports physicals are important for all pediatricians. They allow for screening for pre-existing medical conditions, patient education for sport safety, and an additional opportunity for contact in the medical home. They can, however, be overwhelming. Fortunately, there are many resources to guide you. This includes the American Heart Association's 12-element pre-participation screen. On history, you will ask about exertional chest pain, history of syncope, exercise-induced dyspnea or fatigue, or prior recognition of a heart murmur. These help point to cardiorespiratory illnesses that may be important for a pre-participation evaluation. The AHA emphasizes the importance of a family history, specifically regarding premature death, heart disease in young people, or specific cardiac conditions in the family, such as long QT syndrome. Next, they recommend a 5-point physical exam looking for blood pressure, heart murmurs, femoral pulses, or physical stigmata of Marfan's, all of which may require special sport considerations. Other important physical findings include unequal pupils, a displaced PMI, or findings suggestive of infections, which may put other athletes at risk. Sibley Cardiology has a risk assessment form that can help streamline the cardiac-specific history and physical findings. Now let's look at other health conditions that may require special recommendations. According to the AAP, some health conditions may benefit from particular sports. Diabetics may stabilize their insulin uptake with endurance sports, patients with neuromuscular disturbances may benefit from muscle strengthening, and patients with asthma can benefit from water sports due to the warm, moist air. Finally, obese patients can benefit especially from strength training and martial arts. There are, however, certain conditions that, according to the AAP, disallow sports activity. These include patients with carditis, who may be more at risk for sudden death, or fever, as they may be at increased risk for heat illness or orthostatic hypotension. Though not absolutely restricting, the AAP recommends a qualified no activity for patients with diarrhea due to the risk of dehydration. The AAP suggests a qualified yes for the following conditions, suggesting some individuals should be limited to which sports they should be allowed to play. For example, patients with atlantoaxial instability should avoid high-impact sports, and patients with sickle cell disease should take special precaution to avoid overheating or dehydration. Other conditions with a qualified yes are listed below, including those individuals with diabetes, organ loss, or organomegaly. The recommendations for each of these individuals may be based on the intensity of the sport that they wish to play. Perhaps a patient with only one kidney or an eating disorder may be recommended to only do low-intensity sports. To make matters a little easier, the AAP has classified different sports based on the degree of dynamic and static demands. Interestingly, boxing is the only sport that the AAP uniformly advises against. Low-intensity sports listed below may be better for many of the individuals listed above. This includes bowling and my personal favorite, curling. The AAP also categorized sports based on the degree of physical contact to help families and practitioners find the appropriate sport for each individual. This concludes the overview on sports physicals. Remember, always play safe. Resources can be found below. Thanks for listening.